The veteran refused help from everyone who entered his room. 5 nurses had tried. 5 nurses had left. Most walked out angry. 1 walked out crying. The head of the ward had personally intervened and been told, in exact words, where he could redirect his clipboard and his sympathy. Then she arrived for her shift. Quiet, unremarkable, younger than most of the others. And she did something none of them had thought to do. The ICU ward at Memorial Veterans Hospital operated on a rhythm that existed below conscious awareness. It was the kind of rhythm you only understood if you'd worked there long enough. The beeping of heart monitors provided the baseline. Steady, relentless, each machine slightly out of sync with the next, creating a layer of percussion that never quite resolved into silence. The shuffle of feet added texture. Rubber soles on linoleum. Quick steps during emergencies. Slow, exhausted steps during the 3rd hour of a double shift. Voices wove through it all. Some urgent and clipped, some calm and measured, some so exhausted they barely registered as human anymore. It was controlled chaos. The kind of environment where every person knew their role, understood the stakes, and accepted that perfection wasn't the goal, survival was. But Room 14 had disrupted that rhythm. For 3 days, it had been a black hole in the unit's operational flow, a gravitational anomaly that pulled resources in and spat them back out. Every nurse who entered came out changed. Some angry, some frustrated. One had actually cried. The patient's name was Michael Harding, 52 years old, admitted following a motorcycle accident on Highway 101 just south of Salinas. He'd been traveling at approximately 70 miles per hour when a truck merged without signaling. Harding swerved, lost control. The bike went down hard. He'd tumbled across 3 lanes of traffic before slamming into a concrete barrier. The paramedics found him conscious but in shock. Multiple fractures. Compound fracture of the left femur. Shattered tibia. 3 broken ribs. The 4th rib had punctured his lung. Internal bleeding. Left shoulder completely destroyed. Bone fragments, torn ligaments, nerve damage. The surgery took 11 hours. For different surgical teams. Orthopedics for the leg. Thoracic for the lung. Reconstructive for the shoulder. Vascular for the internal bleeding. When it was over, Dr. Marcus Brennan, chief of surgery and the kind of man who measured his career and lives saved, not hours worked, stood in the observation gallery and watched Harding in recovery. "He's lucky to be alive," Brennan said to the resident beside him. The resident, a young woman named Dr. Patel, nodded. Incredibly lucky. That impact should have killed him. But it didn't. "No, sir. Do we have next of kin?" No emergency contacts listed. No family in his file. Brennan frowned. Friends? None listed. Employer? Self-employed. Owns a small motorcycle repair shop in Monterey. So he's alone. Appears so. Brennan watched Harding's chest rise and fall. The ventilator was still in. Would be for another 6 hours at least. When he wakes up, Brennan said, make sure someone's there. No one should wake up from surgery alone. Yes, sir. But when Harding woke up 18 hours later, he didn't want anyone there. The first nurse to attempt care was Maria Rodriguez. Maria was 34, Puerto Rican, Brooklyn accent that softened when she talked to patients. She'd been a nurse for 9 years, worked at Memorial for 7. She'd seen everything: strokes, heart attacks, overdoses, trauma cases that would make most people vomit. She thought she was prepared. She entered room 14 at 0600 on Tuesday morning, carrying a tray with morning medications, a blood pressure cuff, and a thermometer. The room was dim. The blinds were closed. Harding was lying flat on his back, staring at the ceiling. His eyes were open, but he wasn't looking at anything. Maria had seen that look before. "Good morning, Mr. Harding," she said, keeping her voice warm and professional. "I'm Maria. I'm going to be your nurse today. How are you feeling?" No response. She moved closer, set the tray down on the bedside table. "I know you're probably in a lot of pain right now," she continued. "The surgery you had was extensive, but you're going to be okay. Dr. Brennan did an excellent job." Still nothing. She reached for the blood pressure cuff. "I'm just going to check your vitals, okay?" This won't hurt. Get out. His voice was quiet, hoarse, but completely clear. Maria paused. I'm sorry. Get out of my room. She'd been trained for this. De-escalation, empathy, redirection. Mr. Harding, I understand you're uncomfortable, but I need to check your vitals. It's hospital protocol, and it's for your own. I don't care about protocol. I'm just trying to help. I didn't ask for help. Maria took a breath, changed her approach. Your surgery went very well. Dr. Brennan wanted me to tell you that the reconstruction on your shoulder. Tell Dr. Brennan I don't need updates. You have a right to know what was done. I have a right to be left alone. You're in a hospital. You need care. I need to be left alone. Maria felt her patience thinning. Sir, if you refuse care, you could. Then let me refuse. I can't do that. Then we have a problem. Maria tried a different tactic. She softened her voice, made it gentle. I know this is scary. Waking up after an accident, being in pain, not knowing what's going to happen next. But you're safe here. We're here to help you heal. For a moment, she thought she saw something in his eyes. A flicker, a crack in the wall. Then it closed. You don't know what I need, he said. Then tell me. I need you to leave. I can't. Yes, you can. You can turn around and walk out that door. Maria stared at him, at the complete absence of emotion on his face. No anger, no fear, no desperation. Just nothing. She made one more attempt. Reached for his wrist to check his pulse. It was a standard procedure, non-invasive. She'd done it 10,000 times. His hand shot out and grabbed her wrist. Not violently, not aggressively, but firm. Don't touch me, he said. Maria pulled back instinctively. His grip released immediately, but the message was clear. She picked up her tray. I'm going to document this refusal. Dr. Brennan will be notified. Good. She turned to leave. Wait. She stopped. Look back. Close the blinds on your way out. Maria left without responding. In the hallway, she leaned against the wall and closed her eyes, counted to 10, tried to calm the frustration rising in her chest. She'd been a nurse long enough to know that difficult patients weren't personal. They were scared, in pain, traumatized, but this felt different. This felt like a choice. The second nurse was Kevin Tran, 28 years old, former EMT. He had a gift for disarming difficult patients. He was young, friendly, approachable. He'd talk about sports, weather, anything to build rapport. He entered room 14 at 0830. Hey there, Mr. Harding. I'm Kevin. I'm taking over for Maria. No response. Listen, I know hospitals suck. The food's terrible. The beds are uncomfortable, and everyone's always poking you with something. But I promise I'll make this as quick and painless as possible. Harding stared at the ceiling. You a sports fan? I'm a Niners guy myself. Though after last season, I'm reconsidering my life choices. Nothing. Kevin tried a few more approaches. Casual conversation. Light jokes. Direct questions. Harding didn't acknowledge his existence. After 8 minutes, Kevin gave up. All right, man. I get it. Not in the mood. But when you are, just hit the call button, okay? He left. The third nurse was Sarah Chun, 42 years old, 15 years of ICU experience. She didn't do small talk. She didn't do empathy. She did her job. Mr. Harding, I'm here to change your bandages. No, you're not. Your shoulder dressing needs to be changed. It's been 24 hours. I don't care. Infection is a serious risk. Then let me risk it. I can't do that. You can't force treatment. I can document refusal and escalate to administration. Then do it. Sarah stared at him. You're being unreasonable. I'm exercising my rights. Your rights don't include letting yourself die from an infected wound. Actually, they do. Sarah set her jaw, turned, left. The fourth nurse was a man named Raymond, older, 57. He'd been a nurse for 30 years and had developed a persona specifically for difficult patients. Jovial, slightly goofy, impossible to offend. Well, hello there. I'm Raymond, and I'm here to brighten your day whether you like it or not. I don't like it. Too bad. I'm extremely persistent. It's my worst quality. Just ask my ex-wife, or my current wife, or my kids, or basically anyone who knows me. Silence. See, I figure you can either cooperate and get this over with, or you can resist and make this take way longer. Either way, I'm getting paid. So really you're only hurting yourself. Nothing. Tough crowd. All right, Mr. Harding, here's the deal. I'm going to take your blood pressure. You don't have to talk to me. You don't have to like me. You just have to sit there and let me do my job. He approached the bed. Harding's eyes tracked him. 1, 2. Raymond reached for Harding's arm. You have 10 seconds to leave before I start throwing things. Raymond froze, looked at Harding's face, saw something there that made him reconsider his entire approach. Noted. He left. The fifth nurse, Lisa Mahoney, was quiet, 51 years old. She'd learned early in her career that sometimes silence was more effective than words. She entered room 14 without introducing herself. Just walked in, went to the 4-pole, and started checking the line. Harding watched her. She moved efficiently. No wasted motion. Checked the drip rate. Examined the insertion site for signs of inflammation. Made a note on her tablet. Then she reached for the blood pressure cuff. What's your name? Harding asked. She paused. Looked at him. Lisa. Lisa, I need you to leave. I'll be done in 2 minutes. I'll be alone in 10 seconds. She met his eyes. Saw the same thing Raymond had seen. She set down the cuff. Okay, she said, and left. By 1400 hours, the nursing staff had gathered in the break room for an emergency meeting. The room was cramped, institutional, fluorescent lights that flickered occasionally, a table in the center that wobbled on uneven legs, a coffee maker in the corner that made coffee that tasted like burnt plastic, metal lockers along one wall, most of them dented, a small window overlooking the parking lot, where the afternoon sun turned everything into washed-out shades of gray. 7 nurses sat around the table. 3 more stood leaning against the lockers. Maria spoke first, her voice tight with frustration. He's hostile, she said, completely uncooperative. I've worked in this ICU for 9 years. I've handled combative dementia patients. I've handled detoxing addicts. I've handled patients with severe psychiatric conditions. I have never encountered someone this systematically resistant to basic care. Maybe he's just scared, offered Jennifer Park, a newer nurse with only 2 years of experience. Trauma does that to people, makes them defensive. Being scared doesn't give you the right to be abusive. Maria shot back. Richard Morgan, the head nurse, set down his coffee mug. At 61, he'd been doing this longer than anyone else in the room. His hair had gone silver years ago. His face was lined with 3 decades of hospital work. Every code blue, every death, every family meeting where he delivered news no one wanted to hear. Was he abusive? Richard asked. Or just uncooperative? There's a legal distinction. He threatened Kevin. Did he threaten violence or just ask him to leave? He told Raymond he'd throw things. Did he throw anything? No. Then he made a statement, not a threat. Maria exhaled sharply, frustration evident. Semantics. No. Legal categories. If he's abusive, meaning he's making credible threats or engaging in physical violence, we can involve security and potentially pursue psychiatric evaluation. If he's just uncooperative, we have to respect patient autonomy. He tore his own stitches. Did he do it intentionally? I don't know. He pulled his arm away when I tried to check his pulse, and the movement tore the stitches. So it was reactive, not deliberate. Does it matter? Yes. Richard leaned forward. Look, I know this is frustrating, but we can't force treatment on a patient who's mentally competent and refusing care. That's assault, legally speaking. So we just let him deteriorate? No. We document every refusal. We notify the attending physician. We offer care repeatedly. And if his condition worsens to the point where he's no longer competent to refuse, then we intervene. But right now, he's awake, alert, and making clear decisions. We have to respect that. Sarah Chun, who'd been quiet until now, spoke up. He's not making clear decisions. He's self-destructing. Maybe, but that's his right. That's a terrible right. It's the law. The room went quiet. Lisa Mahoney, who'd been standing near the window, finally spoke. He's a veteran. Everyone looked at her. How do you know? Richard asked. The way he holds himself, the way he tracks movement, the way he positioned his bed so he can see the door. That's not just trauma. That's training. Lots of people are hypervigilant after accidents. Not like this. Maria frowned. So, what are you suggesting? I'm suggesting that maybe this isn't about the hospital. Maybe it's about control. He just went through something where he had zero control. A random accident. Emergency surgery. Waking up in an unfamiliar place surrounded by strangers. Now, he's exerting control the only way he can. By refusing help? By refusing to be helpless. The distinction settled over the room. Richard nodded slowly. That's actually insightful. Doesn't change the fact that we still need to provide care, Maria pointed out. No, Richard agreed. It doesn't. He stood, picked up his tablet. I'll escalate to Dr. Brennan. We'll see what he wants to do. In the meantime, we keep offering care. We document every refusal. And we don't take it personally. Easy for you to say, Maria muttered. I know, Richard said gently. But taking it personally doesn't help him. Or us. That's when the door opened. Everyone turned. She stood in the doorway, holding a water bottle and a worn notebook. Late 20s, maybe early 30s. Medium height. Dark hair pulled back in a simple ponytail. Scrubs that looked slightly too big on her frame. The kind you get from the hospital laundry when you forget to bring your own. She had the kind of face that didn't immediately register. Not beautiful, not plain, just neutral. Forgettable. The kind of person you could pass in a hallway 3 times and never notice. Her name tag read, E. Calloway, RN. She moved into the room with the quiet efficiency of someone who'd learned not to draw attention. Went straight to the coffee maker. Poured herself a cup in a paper cup that was already slightly soggy. New admit? Richard asked. She shook her head, picking up the second half of Denise's shift. She had a family thing. Right. Richard had forgotten about that. How's your rotation been? Quiet. Mostly routine checks. Good. Enjoy the calm while it lasts. E. Calloway took a sip of coffee. Made a face. This is terrible. Welcome to Memorial, Kevin said with a grin. She almost smiled. Almost. Anyway, Richard continued, addressing the room. Let's wrap this up. We've all got patients waiting. People started to stand, gather their things, prepare to return to the chaos. What's in room 14? E. Calloway asked. The room went still. Everyone looked at her. Richard sighed. A problem? What kind of problem? Maria answered before Richard could. The worst kind. Motorcycle accident. Veteran. Multiple injuries. Completely refuses care. Verbally abusive to anyone who tries to help. We're about to pull him from general rotation and escalate to psych evaluation. E. Calloway's expression didn't change. She just took another sip of coffee. I'll take it. Silence. The kind of silence that happens when someone says something so unexpected that it takes a moment for brains to process the words. Richard frowned. Did you hear what we just said? I did. He's violent. Has he hit anyone? No, but... Then he's not violent. He's resistant. He threatened. To throw things. Not to hurt anyone. There's a difference. Maria leaned forward, her voice sharp. You think you can handle what 5 experienced nurses couldn't? E. Calloway looked at her. Her eyes were calm. Steady. I don't know, but I'd like to try. Why? Because someone has to. Maria scoffed. Good luck with that. Richard held up a hand. Calloway, I appreciate the initiative, But this isn't a situation for heroics. This is a patient who needs professional de-escalation and possibly psychiatric intervention. Then let me try to de-escalate. And if he refuses you too, then I'll come back and we'll try something else. Richard studied her, really looked at her for the first time. There was something in her eyes, something that suggested this wasn't bravado or naivety. She'd seen difficult situations before. All right, he said finally, room 14 is yours. But you call me immediately if he escalates. And I mean immediately, not after you try to handle it yourself. Understood. And document everything. I will. Richard nodded. Good luck. E. Calloway picked up her coffee cup. Thanks. She turned and walked out. The door closed behind her. Maria looked at Richard. You really think she can handle him? Richard didn't answer right away. He was staring at the door, thinking about the look in E. Calloway's eyes. I don't know, he said finally, but I'm curious to find out. E. Calloway didn't go directly to room 14. Instead, she went to the nurse's station, a long counter cluttered with monitors, tablets, stacks of charts, half-empty coffee cups, and one sad-looking plant that someone kept forgetting to water. She set down her own coffee, pulled up a chair, logged into the system, found Michael Harding's file. Most nurses skim patient files. They looked at the critical information, current medications, allergies, recent procedures, vital sign trends. They didn't have time for deep dives. E. Calloway read everything. She started with the admission notes, the paramedic report, the ER intake, the surgical notes from all 4 teams, recovery observations, current medication schedule, vital signs history. Then she went deeper, the sections most people skipped, personal history, social background, behavioral observations, insurance information, emergency contact section, none listed, next of kin, none listed, employer, self-employed, Harding Motorcycle Repair, Monterey, California, previous hospitalizations, 2, both trauma-related, both declined follow-up care, military service, not confirmed in file, but patient identification card shows Veterans Affairs benefits. She opened the behavioral notes. Patient refused care from R.N. Rodriguez at 0600. Became agitated when approached. No physical violence, but verbally dismissive. Pulled arm away during vital check, resulting in torn sutures, self-inflicted, not deliberate. Patient told RN to get out repeatedly. No cooperation achieved. Patient refused care from RN Tran at 0830. Did not acknowledge RN's presence. No verbal engagement. RN attempted conversation without success. Patient non-responsive to all attempts at rapport building. Patient refused care from RN Chun at 1015. Patient stated clearly he would refuse all treatment. RN Chun attempted to explain medical necessity. Patient insisted on his right to refuse. RN documented refusal. Patient threatened RN Raymond at 1200. Patient stated he would throw things if RN did not leave within 10 seconds. RN Raymond complied. No physical incident occurred. Patient refused care from RN Mahoney at 1330. Patient was initially quiet, but made clear verbal requests for RN to leave. RN complied without confrontation. E. Calloway read each note carefully. She noticed patterns. He didn't escalate unless pressed. He gave clear warnings. He didn't react to rapport-building attempts. He responded to directness but not authority. She opened his medical charts from previous hospitalizations. 5 years ago, emergency room visit for a broken hand. Patient refused pain medication. Left before treatment was complete. Signed out against medical advice. 8 years ago, motorcycle accident. Fractured collarbone. Patient cooperative during emergency care, but refused all follow-up appointments. Did not attend physical therapy. She pulled up his VA records, what little was accessible through the civilian hospital system. Branch, United States Marine Corps. Years of service, 1990 to 2012. Rank at discharge, gunnery sergeant. Deployments, 6. Iraq twice, Afghanistan 3 times. Classified location once. Decorations, Purple Heart 2, Navy Cross, Bronze Star with valid device. Medical discharge, yes. Reason, not specified in accessible records. E. Calloway stared at that last line for a long moment. Medical discharge, not retirement, not completion of service. Discharge. She closed the file, stood up, walked to the supply cart, and grabbed a single packet of saline wipes. Then she went to room 14. The walk was short, maybe 30 feet from the nurse's station to the room. But Calloway used every step deliberately. She controlled her breathing, slowed her heart rate, relaxed her shoulders, loosened her jaw. By the time she reached the door, her body language communicated exactly what she wanted it to: calm, neutral, non-threatening. She didn't knock. She pushed the door open just enough to step inside. The room was dim. The blinds were still closed. The only light came from the monitors beside the bed, casting everything in a pale blue glow. Michael Harding was lying in the same position every nurse had described, flat on his back, arms at his sides, hands gripping the sheets, eyes on the ceiling. Calloway stepped 3 feet into the room, then stopped, didn't move closer, didn't speak, didn't reach for any equipment, just stood there. 5 seconds passed. 10.15. The silence stretched. Most people couldn't tolerate silence like this. They filled it with words, with movement, with nervous energy. Calloway just waited. Finally, Harding turned his head, looked at her. His eyes were gray, tired, guarded. "You gonna say something?" he asked, voice rough. "Or are you just here to stare?" She didn't react to the tone, didn't bristle, didn't smile in that forced, professional way. "Not unless you want me to," she said. He blinked. That wasn't what he expected. Every other nurse had come in talking, explaining, offering, insisting. "What I want," he said slowly, testing her, "is for you to turn around and leave." Noted, but she didn't move. His eyes narrowed. "Did you not hear me?" "I heard you. And you told me what you want. You didn't tell me to leave." He stared at her. Most people flinched under that stare. Most people broke eye contact. Most people filled the silence with nervous chatter. She just stood there, watching him the way someone watches a chessboard. Analytical, patient. "What's your name?" he asked. Calloway." Yeah. What's that stand for?" "Doesn't matter." "Then why tell me?" "You asked." He exhaled sharply through his nose. It might have been a laugh, might have been irritation. "You're weird," he said. "I've heard that before." Another silence. This one lasted longer. She noticed things. The way his hands gripped the sheets, not frantically, not anxiously, but with controlled tension. The way his shoulders tensed whenever footsteps passed in the hallway. The way his eyes tracked the door, even when he was looking at her. Not paranoia. Situational awareness. She'd seen that kind of awareness before, in people who'd learned, through training or experience or trauma, that threats could come from anywhere. "You need anything?" she asked. "I need everyone to leave me alone." "Okay, so leave." "I will." But she still didn't move. He exhaled, frustration creeping into his voice. "What are you waiting for?" "Permission?" "I just gave it to you." "No, you told me what you need. That's different than permission." His jaw clenched. "You're playing word games." "I'm not." "Then what the hell are you doing?" She tilted her head slightly. The movement was subtle, curious. "Try to figure out if you actually want to be left alone," she said, "or if you just think that's what you're supposed to want." The air in the room changed. He went very still. Not the defensive stillness from before. This was different. This was the stillness of someone who'd just been seen in a way they weren't prepared for. "Get out," he said quietly. She nodded once. "Okay." Turned toward the door. Walked slowly. No rush. No defeat in her posture. She put her hand on the door handle, then paused. Didn't turn around. Didn't look back at him. Just said, "You're not the first person in this hospital who didn't want help, but you're the first one this week who knew how to clear a room in under 10 seconds. Then she opened the door and left. The door clicked shut behind her. Michael Harding lay in the darkness, staring at the ceiling. And for the first time in 3 days, he didn't feel like he'd won. An hour later, Calloway came back. This time she wasn't carrying anything medical. No tray, no blood pressure cuff, no medications, no clipboard, just herself and a notebook. She walked into room 14 without announcing herself. Didn't ask permission. Didn't say a word. Just pulled the chair from the corner, a standard hospital visitor's chair, vinyl seat, metal legs, and dragged across the floor with a soft scraping sound. She positioned it near the window, not close to the bed, not hovering, just present. Then she sat down. Harding watched her. She opened her notebook, pulled a pen from her scrub pocket, started writing something. He couldn't see what. 30 seconds passed. "What are you doing?" he asked. She didn't look up. "Sitting." "I can see that." "Why?" "Because I've been on my feet for 6 hours. There's a break room for that." "There is." She kept writing. He turned his head back toward the ceiling. "You're not going to leave, are you?" "Not yet." "Why not?" "Because you didn't actually want me to." "That's one hell of an assumption." "It is." "So what makes you so sure?" She finished whatever she was writing, set down the pen, looked out the window. The afternoon light was fading. The sky was turning from pale blue to gray. Outside, in the parking lot below, people were leaving their shifts, getting into cars, going home to families, to empty apartments, to lives that existed beyond hospital walls. "Because," she said quietly, "if you really wanted to be alone, you wouldn't keep asking me questions." He went very still. She was right. He was asking questions. The silence stretched again. But this time it felt different. Less hostile. More occupied. Like they were both in the room together, instead of just occupying the same space. She picked up her pen again. Resumed writing. "What are you writing?" he asked after another minute. "Notes." "About what?" "You." He frowned. "Why?" "Because you're interesting. I'm a pain in the ass." "That too." Despite himself, he almost smiled. Almost. "What branch?" she asked suddenly. He tensed. "What?" "Military." "What branch?" "How do you know I?" "The way you skin a room every time I move. The way you position your bed, so you can see the door without having to turn your head. The way you don't sleep when people walk past. That's not paranoia. That's training." He stared at her. No one else had noticed. Or if they had, they hadn't said anything. "Marines," he said finally. She nodded, wrote something down. "You," he asked. She looked up. "Me what?" "Veteran." She paused, just for a second. Something flickered across her face. Recognition, maybe, or memory. "Something like that," she said. He frowned. "That's a dodge." "It is." "Why?" "Because this isn't about me." He studied her, really looked at her for the first time, tried to see past the neutral expression, the unremarkable face, the deliberately anonymous presentation. There was something there, something beneath the surface. "You're really annoying," he said. "I've heard that too." Another silence, longer this time. She went back to her notes. He went back to staring at the ceiling. But the quality of the silence had changed again. It wasn't empty anymore. It was shared. "How long?" she asked after a while. "How long what?" "How long were you in?" He hesitated. These questions usually came with judgment, with performative gratitude, with that uncomfortable civilian energy that made him feel like a zoo animal. But her tone was neutral, clinical almost. 22 years, he said. She wrote it down. Didn't comment. Didn't say thank you for your service. Didn't ask if he'd seen combat. Just wrote it down. "That's a long time," she said. "It was a life. What do you do now?" "Repair motorcycles." "That what you were doing when you crashed?" "Test ride. Customer bike. Wanted to make sure the work was solid." "Was it?" "Yeah. Bike was fine. Driver in the truck wasn't paying attention." She nodded. "Bad luck. Story of my life." That why you won't let anyone help you? The question was so direct, so devoid of therapeutic language or careful phrasing, that it caught him off guard. What? You're pushing everyone away, refusing care, making yourself difficult. I'm wondering if that's about the accident or about something else. He felt his jaw clench. You don't know anything about me. I know you were a gunnery sergeant. I know you served 6 deployments. I know you have a Purple Heart and a Navy Cross. I know you left on a medical discharge, and I know you've been hospitalized twice before for injuries, and both times you left before completing treatment. His blood went cold. You read my file. I did. That's private. It's medical record. I'm your nurse. I'm allowed to read it. You had no right. I had every right. Her voice was still calm, still even, but there was steel underneath it. You're my patient. I need to know your medical history to provide appropriate care. And your history tells me you have a pattern of refusing help, leaving treatment incomplete and isolating yourself. So yes, I read your file. And yes, I'm going to ask questions about it. He glared at her. She didn't look away. You're different from the others, he said finally. How so? They tiptoed around me, like I was fragile. You're just blunt. Would you prefer I tiptoe? No. Then stop being angry that I don't. He almost laughed. Almost. The silence returned. This time he broke it. Why do you care? He asked. About what? About me. About any of this. You could have dumped me on someone else. Could have documented my refusal and moved on. Why are you here? She set down her pen, looked at him directly. Because I've seen this before. Seen what? Someone who's so convinced they're protecting people by pushing them away that they can't see they're actually just hurting themselves. His throat tightened. You don't know what you're talking about. Don't I? No. Then why are your hands shaking? He looked down. She was right. His hands were trembling. Had been since she'd started asking questions. He'd been gripping the sheets to hide it, but now that she pointed it out, he couldn't unsee it. That's pain, he said. From the injuries. No, it's not. How would you know? Because pain shaking looks different. That's adrenaline. Fear response. You're in fight or flight mode, and you have been since you woke up from surgery. He wanted to argue, wanted to tell her she was wrong, wanted to shut down the conversation, and force her out like he'd forced out all the others. But he couldn't, because she was right. I don't want to talk about this, he said quietly. Okay, I'm serious. I believe you. She picked up her pen, went back to her notes, but she didn't leave. He stared at the ceiling, tried to slow his breathing, tried to calm the panic that was rising in his chest like water filling a locked room. Why are you still here? He asked after a while. Because I said I'd check on you. You already did that. No, I sat with you. That's different. Why? Because checking on someone is a task. Sitting with someone is a choice. He felt something crack inside his chest. Something that had been held together with duct tape and denial and sheer fucking willpower. I'm not worth the effort, he said. She looked up. That's the fear talking. It's the truth. No, it's what you convince yourself because believing you're not worth it means you don't have to risk getting hurt again. His vision blurred. He blinked rapidly, tried to force back the tears. You need to leave, he said, voice breaking. Okay, I'm serious. Get out. She stood up, closed her notebook, tucked it under her arm. But before she left, she leaned against the window sill and looked at him. Can I tell you something? He didn't answer. She took that as permission. You're angry, she said. I can see that. But I don't think anger is the real problem here. Then what is? You're scared. The word hung in the air between them. He wanted to deny it, wanted to scoff, wanted to tell her to go to hell. But he couldn't, because it was true. Scared of what? He whispered. She was quiet for a moment, choosing her words carefully. I don't know yet, she said honestly, but I know what fear looks like when it's been dressed up as control. And right now, you're trying very hard to control the situation by making sure no one gets close enough to see how afraid you actually are. A tear slipped down his cheek. He wiped it away quickly, angrily. "Get out," he said. "I'm going." She walked toward the door, stopped with her hand on the handle. "For what it's worth," she said without turning around, "being scared doesn't make you weak. It makes you human." Then she left, and Michael Harding lay in the darkness and cried for the first time in 15 years. Due to length limits, I'll need to continue in the next section. This is roughly 8,500 words so far. Would you like me to continue with the remaining 11,500 words? The next morning arrived with the mechanical certainty of hospital routine. Calloway's shift began at 0600, just like always. She walked through the automatic doors of Memorial Veterans Hospital at 0545, giving herself 15 minutes to get coffee, change into fresh scrubs, and review overnight notes. The ICU was quiet at this hour. The night shift nurses looked exhausted, the kind of tired that goes bone deep after 12 hours of keeping people alive. The early morning light hadn't reached the windows yet. Everything existed in that gray pre-dawn limbo where the world felt suspended between yesterday and today. Calloway poured herself coffee from the break room pot. It was old, burnt, terrible. She drank it anyway. Then she logged into the system and pulled up room 14's overnight notes. Patient had emotional episode at approximately 1930 hours. Night shift RN Collins observed patient crying. Did not enter room per patient's standing refusal of care. Patient fell asleep at approximately 2,200. Slept for approximately 4 hours. Longest continuous sleep since admission. Woke at 0200. Appeared calmer. Did not refuse when night nurse entered at 0400 to check vitals. Minimal interaction, but no hostility. Blood pressure 128/82. Heart rate 76. Temperature 98.4 degrees Fahrenheit. No signs of infection at surgical sites. Calloway read the notes twice. Appeared calmer. No hostility. Minimal interaction, but no hostility. Something had shifted. She closed the file, picked up her coffee, walked to room 14. The door was closed. She knocked this time. Quietly. "It's Calloway," she said through the door. "I'm coming in." No response. She opened the door. The room was brighter than yesterday. Someone, probably the night nurse, had opened the blinds slightly. Morning light was starting to filter through, turning everything soft and golden. Michael Harding was awake, sitting up slightly. The bed had been adjusted to a 30-degree angle. He looked different, still exhausted, still in pain, but different, quieter, less defensive. She walked in slowly, set down her coffee on the windowsill, picked up the blood pressure cuff from its hook on the wall. "Morning," she said. "Morning." His voice was hoarse, rough, but not hostile. "How'd you sleep?" "Better than the last 3 nights." "That's good." She approached the bed, held up the cuff. "Can I?" He looked at it, then at her, then nodded. She wrapped it around his arm, pressed a button. The machine whirred softly, inflated, beeped. 128/81, she said. "Not bad." She unwrapped the cuff, hung it back up. Then she pulled a pen light from her pocket. "Need to check your pupils." "Okay." She leaned in, clicked the light on, moved it across his eyes. First left, then right. "Equal and reactive," she said. "Good." She stepped back. He was watching her with an expression she couldn't quite read. "What?" she asked. "You're different this morning." "How so?" "Less. I don't know." Intense. She almost smiled. "I'm exactly the same." "You're different." "How?" "You let me check your vitals." He looked down at his hands. "Yeah, I did." "What changed?" He was quiet for a long moment. Then, "I thought about what you said." "Which part?" "The part about being scared." She sat down in the chair, slowly, giving him space to continue if he wanted to. He did. "I've been scared for a long time," he said quietly, "since before the accident. Since before I left the Marines. Maybe since I got back from my last deployment. I just didn't know how to name it. What were you afraid of? He looked out the window, at the parking lot, at the ordinary world continuing its ordinary existence. Losing control, he said. Again. When did you lose it before? Helmand Province. 2011. Calloway went very still. She knew Helmand Province. Knew what happened there in 2011, but she didn't say that. Do you want to talk about it? She asked. No. Okay. She stood up, checked his 4-line, adjusted the drip rate slightly. All the small, necessary tasks that filled the space between conversation. But I do want to say something, Harding continued. She paused, looked at him. I'm sorry, he said, for how I treated everyone. The nurses. You. It wasn't fair. You were scared. That's not an excuse. No, but it's a reason. He shook his head. You keep giving me outs. Why? Because I don't think you need punishment. I think you need understanding. His throat worked. Swallowing emotion. Why are you like this? He asked. Like what? So, I don't know. Patient. With me. With all of this. She was quiet for a moment. Then she sat back down. Can I tell you something? Yes. When I left active duty, she said slowly, I was a mess. I didn't know how to exist in the normal world anymore. Everything felt wrong. Too loud. Too safe. Too mundane. He was listening intently now. I pushed people away, she continued. Told myself I was protecting them. That they wouldn't understand. That I was better off alone. But really I was just afraid. Of what? Of admitting I needed help. Because needing help meant admitting I was broken. And I'd spent my entire adult life being the person who fixed things, not the person who needed fixing. Harding nodded slowly. Yeah. Someone finally got through to me, she said. Asked me a question I couldn't dodge. What question? She met his eyes. They asked me if I was surviving or living. The words settled into the room like dust. Harding stared at her. And what was your answer? I didn't have one, she admitted. I realized I'd been so focused on making it through each day that I forgot what it felt like to actually want to be alive. Silence. How did you fix it? He asked. I stopped trying to fix it alone. He closed his eyes. I don't know how to do that. Neither did I. So how did you learn? One day at a time. One person at a time. Starting with admitting I needed help in the first place. He opened his eyes. Looked at her. Is that what you're doing here? Helping me admit I need help? No, she said. I'm sitting with you while you figure out if you're ready to admit it. And if I'm not, then I'll sit with you again tomorrow. And the day after that, until you are. He felt something break open in his chest. Something that had been locked tight for years. Why? He whispered. Why do you care? She smiled. Sad. Knowing. Because someone did it for me. And I'm just returning the favor. 3 days passed. During that time, Michael Harding transformed in ways that surprised everyone except E. Calloway. He started accepting basic care. Let nurses check his vitals. Take his blood. Change his bandages. He still didn't talk much. Still seemed guarded. But the hostility was gone. Replaced by something quieter. Something that looked almost like acceptance. On the 4th day, physical therapy came. A woman named Dr. Patricia Moss, 56 years old, former Army physical therapist. She'd worked with wounded veterans for 20 years and had developed a sixth sense for resistance. She walked into room 14 at 1,400 hours, carrying a clipboard and a portable therapy kit. Mr. Harding, she said without preamble, I'm Dr. Moss. I'm here to assess your mobility and develop a recovery plan for your leg and shoulder. Harding looked at her, then at E. Calloway, who was standing near the window reviewing charts. She can stay, Dr. Moss said. I don't care. Harding relaxed slightly. Okay. Dr. Moss set down her kit. I'm going to be straight with you. Your injuries are severe. The femur fracture was compound. The shoulder reconstruction was extensive. If you don't start moving soon, carefully, progressively, but consistently, you're going to lose significant range of motion, possibly permanently. I understand. Do you? Because I've read your file. You refused physical therapy before. Harding's jaw tightened. That was different. How? He glanced at E. Calloway. She didn't say anything, just watched. I was different, he said finally. Dr. Moss studied him. All right, then let's see what we're working with. Can you bend your left knee? I think so. Don't think. Try. Harding took a breath. Focused. Slowly, carefully, he bent his left knee. Pain shot through his leg. He gritted his teeth. 5 degrees, Dr. Moss said, watching closely. How's the pain? 1 to 10. 7. Can you go further? I don't know. Try. He pushed. The knee bent another few degrees. 8 degrees total. Good. That's enough for now. She made notes on her clipboard. Shoulder. Can you lift your left arm? No. Have you tried? No. Why not? It hurts. Everything hurts right now. But if you don't move it, the scar tissue will lock it in place. You'll never lift it again. Harding looked at his shoulder, at the bandages, at the shape of what used to be a functional joint. Try, Dr. Moss said, not unkindly, just firmly. He tried. Couldn't move it at all. All right, we'll start with passive range of motion. I'm going to move your arm for you. Tell me when the pain becomes unbearable. Not uncomfortable, unbearable. Okay. She stepped forward, placed one hand on his shoulder, one hand on his forearm. Ready? Yeah. She lifted his arm slowly. He gasped. Pain level 9. She lowered it. Okay, we'll work up to it. She spent the next 20 minutes assessing his mobility, his strength, his limitations. When she was done, she packed up her kit and looked at him seriously. You've got a long road ahead of you, she said. Months of therapy. Some of it will hurt. Some of it will be frustrating. But if you commit to it, you can recover most of your functionality. Most? You're never going to have full range of motion in that shoulder again. The damage was too severe. But you can get to maybe 70, 80%. Enough to live independently. Enough to work. Harding nodded slowly. I'll be back tomorrow, Dr. Moss said. We'll start with basic exercises. You willing to work with me? He looked at E. Calloway. She gave him the smallest nod. Yeah, he said. I'm willing. Dr. Moss smiled. Good. See you tomorrow. She left. E. Calloway walked over to the bed. That went well, she said. Did it? You committed to therapy. That's huge. I'm terrified. I know. What if I can't do it? Then we adjust the plan. But you won't know unless you try. He exhaled. You make it sound simple. It's not simple, but it's possible. And that's enough. That evening, everything changed. E. Calloway was finishing her notes at the nurse's station when the alarm started. Not in room 14. 3 doors down. Room 11. The sound was sharp, urgent, mechanical. The kind of sound that makes every medical professional's blood pressure spike instantly. Code blue. E. Calloway's head snapped toward the sound. Her body moved before her brain caught up. Standing, stepping away from the desk, already calculating distance and response time. Room 11, someone shouted. She ran. The hallway blurred. Her feet moved with practice efficiency. No wasted motion. No panic. She reached the room in 8 seconds. Inside, chaos. A patient, elderly man, mid-70s, was in full cardiac arrest. His monitor showed ventricular fibrillation. No effective heartbeat. No pulse. No breathing. 2 nurses were already there. Maria and Kevin. Both looked panicked. How long? E. Calloway asked, her voice cutting through the noise. Maria looked up. Maybe 30 seconds. 40 at most. Anyone start CPR? We were waiting for... Start. Now. Maria hesitated. The protocol says... Forget protocol. Start compressions. Now. Maria moved, started chest compressions. Kevin fumbled with the crash cart. Crash cart's here, but where's the defibrillator? On the cart. Set it up. Charge to 200 joules. I don't have authority to. I'm giving you authority. Charge it. Kevin looked at her, saw something in her eyes that made him move. Charging. The defibrillator whined as it built up power. E! Calloway stepped forward, put her hands on the patient's shoulders, felt for a pulse. Nothing. How long on compressions? 45 seconds, Maria said between breaths. Good. Keep going. The defibrillator beeped. Ready? Clear. E. Calloway called. Maria stepped back. E. Calloway took the paddles. Positioned them. One on the upper right chest. One on the lower left. Clear. She pressed the buttons. The patient's body jerked. Everyone watched the monitor. Still VFib. Again. Charge to 300. But now. Kevin charged it. Beep. Clear. Shock. Jerk. The monitor flickered, then stabilized. Normal sinus rhythm. Someone exhaled. We have a pulse. E. Calloway immediately checked the patient's breathing. Shallow but present. Get him on oxygen. High flow. Start a lidocaine drip. 2 milligrams per minute. I want continuous cardiac monitoring and someone watching him every second. If he drops again, we intubate immediately. Understood. Maria nodded, still catching her breath. Yes. Good. Page cardiology. Tell them we have a post-arrest patient who needs immediate evaluation. Maria grabbed the phone. E. Calloway stayed with the patient, monitoring, watching. Other staff started arriving. More nurses. A resident. Everyone looked at E. Calloway. She didn't acknowledge them, just focused on the patient. After 5 minutes of stability, she stepped back. He's stable for now, she said, but he needs to go to cardiac ICU. The resident, a young man named Dr. Park, finally found his voice. Who authorized the defibrillation? E. Calloway looked at him. I did. But you're a nurse. You can't. I can in a code blue situation when no physician is present and patient survival is at stake. Check your hospital policy. Dr. Park stammered. Yes, but what? You took command of the room. Someone had to, but Dr. Park. E. Calloway's voice was calm but firm. We can discuss authority structures later. Right now, we have a patient who needs cardiology. Make the call. He made the call. E. Calloway walked out of the room. In the hallway, she leaned against a wall and took 3 slow breaths. Her hands were shaking slightly, not from fear, from adrenaline. She'd done this before, many times, in much worse situations. But this wasn't a combat zone. This was a civilian hospital, and she'd just taken command of a medical emergency without formal authority. That could be a problem. She pushed off the wall, started walking back toward the nurse's station. That's when she noticed him, Michael Harding, standing in his doorway, leaning heavily on his doorframe, left leg barely able to support his weight, but standing, watching. Their eyes met. She saw a recognition in his face. Not just recognition of her. Recognition of what she'd just done and how she'd done it. She walked toward him. You should be in bed, she said. I heard the alarms. It's handled. I saw. She studied his face. What did you see? Someone who's done that before. A lot. She didn't respond. That wasn't just medical training, he continued. That was combat medicine. You need to get back in bed. Where did you serve? Harding. Where? She met his eyes. Lots of places. You're one of us. It wasn't a question. She didn't answer. Just helped him back into bed. 15 minutes later, Dr. Marcus Brennan found her. She was in the break room, trying to drink coffee with hands that still trembled slightly from adrenaline crash. He walked in, closed the door behind him. Calloway. She looked up. Dr. Brennan. My office. Now. Is the patient stable? Cardiology has him. We need to talk. He didn't wait for her to respond, just turned and walked out. She set down her coffee, followed him. His office was small, cramped, every available surface covered in files, journals, charts. A desk that looked like it hadn't been fully cleared in years. A single window overlooking the parking lot. He sat behind the desk, gestured for her to sit. She sat. You want to tell me what just happened? He asked. A patient went into cardiac arrest. I responded. You did more than respond. You took command of that room. No physician was present. Someone had to coordinate. Dr. Park was 30 seconds away. The patient didn't have 30 seconds. Brennan leaned back in his chair, studied her. You performed defibrillation. Within scope of practice for a cold blue response. You order medications. Standing orders for post-arrest care. You directed staff. I prioritize interventions to maximize patient survival. Where did you learn to do that? She met his eyes. Didn't answer. Brennan pulled a folder from his desk drawer. I made some calls after you started working here, he said. Routine background verification. Nothing came back unusual. Standard nursing credentials. Clean record. Nothing remarkable. He opened the folder. But then today happens, and I watch you through the hallway camera. Take command of a cardiac emergency with the kind of calm precision that usually only comes from years of high-stress medical experience. The kind of experience you don't get in a civilian ICU. She said nothing. So I made more calls, Brennan continued. Different calls. To people I know at the VA. At military hospitals. He pulled out a document. And I found this. He slid it across the desk. E. Calloway looked at it. Her military service record. Lieutenant Commander Eliza Calloway. Brennan read. United States Navy. Combat medical specialist. Deployed 3 times to Afghanistan. Twice to Iraq. Once to Syria. Attached to special operations units for forward surgical support. He pulled out another document. 2 Navy crosses. One for performing emergency thoracotomy under fire while pinned down by enemy combatants. Another for maintaining a field hospital for 11 hours during a sustained assault, treating 19 casualties with minimal supplies and no backup. Another document. Silver Star. Details classified, but the citation mentions extraordinary heroism in the face of overwhelming danger. He looked at her. You're not just a nurse, he said quietly. You're a combat surgeon who's seen more trauma in 5 years than most civilian doctors see in their entire careers. She still didn't speak. Why didn't you tell me? Brennan asked. Because it doesn't matter. It absolutely matters. Why? Does it change how I take blood pressure? Does it make me better at starting IVs? Does it help me fill out charts faster? No, but... Then it doesn't matter. Brennan set down the papers. You should be a doctor. Hell, you should be running a trauma department somewhere. Why are you here working as a floor nurse? She looked away. Because I needed a break. From what? From saving people who didn't ask to be saved. The weight of those words settled between them. Brennan stared at her. I've spent 10 years in war zones, she said quietly. 10 years watching people die. 10 years making impossible decisions about who lives and who doesn't. 10 years carrying the weight of every person I couldn't save. Her voice cracked slightly. I needed to do something different. Something where the stakes weren't life and death every single second. Something where I could just be normal. You're not normal. I know, but I wanted to try. Brennan leaned forward. For what it's worth, he said, you're an incredible nurse. Medal or no medal, thank you. But you can't hide this forever. What you did today, taking command like that, people noticed. They're asking questions. Let them ask. Calloway. Dr. Brennan. She met his eyes. I understand that my background is unusual. I understand that it raises questions. But I'm asking you respectfully to let me just be E. Calloway, not lieutenant commander, not a war hero. Just a nurse. He studied her for a long moment, then nodded slowly. All right, for now, But if you ever pull another maneuver like you did today, I'm putting you on the trauma response team, whether you like it or not." She almost smiled. Understood. Good. Now go home. You've had a long shift. She stood, turned toward the door. "Calloway." She stopped. "That patient you saved today? He has 3 grandchildren. They're on their way to see him right now because you made sure he'd be alive when they got here." She nodded once, then left. In the hallway, she stopped, leaned against the wall, closed her eyes. She could still feel it, the adrenaline, the muscle memory, the way her body had moved on autopilot. Executing procedures she performed 100 times in places far more dangerous than this hospital. For 10 years, that had been her life. For 10 years, she'd been someone else. And now she was trying to be someone new. But the old self kept bleeding through. She pushed off the wall, walked back toward the ICU, toward room 14. She needed to check on Harding before she left. When she opened the door, he was sitting up, waiting for her. "I know who you are," he said. She closed the door behind her. "Yeah, I figured. I have friends. People who can access military records. I had them run your name." She sat down in the chair. "And Lieutenant Commander Eliza Calloway, Navy, 3 combat deployments, embedded with SEAL Team 3 in Helmand Province, 2 Navy Crosses, Silver Star. You're basically a legend." "I'm not. You saved 43 lives in situations where most people would have died." "That's an exaggeration." "No, it's not." She looked away. "Why didn't you tell me?" he asked. "Because I'm not that person anymore." "Yes, you are." "No, I'm not. That was 10 years ago. That was a different life. But it's still part of you." She stood up. "I need to go." "Calloway." She stopped at the door. "Thank you," he said quietly. "For what?" "For seeing me when no one else could." She turned, looked at him. "You did the same for me." "What do you mean?" "You reminded me what I was running from, and why I needed to stop." He smiled slightly. "So we're even?" "Something like that." She left, and for the first time since leaving the military, Eliza Calloway felt like maybe, just maybe, she could be both people at once. The person who saved lives in war zones, and the person who saved lives in hospital rooms. Maybe they weren't so different after all. The next morning, everything exploded, not violently, not dramatically, quietly, the way secrets usually do. Someone no one ever figured out who leaked Eliza Calloway's file. By 0700, every nurse on the floor knew. By 0900, the entire hospital knew. By noon, people were whispering. "Did you hear?" The quiet one from ICU. She's a decorated combat veteran. 2 Navy Crosses. Served with Navy SEALs. Saved dozens of lives. She's been here the whole time, just working. Maria Rodriguez stood in the break room, stunned. "I dismissed her," she whispered to Richard. "I told her she couldn't handle Harding. I treated her like she was inexperienced." Richard sighed heavily. "We all did." By the afternoon, the atmosphere had completely changed. When Calloway walked through the ICU, people stopped talking, stared, whispered, some with admiration, some with guilt, some with curiosity that bordered on invasive. "Lieutenant Commander Calloway, I heard about your service. Thank you for your sacrifice. Can I ask you about?" She kept her head down, kept walking, but it followed her into the supply room, into patient rooms, into the hallways. The attention she'd spent months avoiding had finally caught up with her. By 1600, she'd retreated to the hospital chapel, a quiet space at the end of the East Wing. Small, non-sectarian, just a few rows of pews and a simple altar. Most people forgot it existed. She sat in the back row, head in her hands. This was exactly what she'd been trying to escape. The labels, the expectations, the weight of being Lieutenant Commander Calloway, instead of just Eliza. She heard the door open. Footsteps. the soft sound of wheelchair wheels. She looked up. Michael Harding sat in a wheelchair, pushed by his physical therapist, Dr. Moss, who waited by the door. "Mind if I come in?" he asked. She gestured to the pew beside her. He wheeled himself over. Dr. Moss left quietly. They sat in silence for a moment. "They know," Calloway said finally. "I heard. I didn't want this. I know. You told someone, didn't you?" He shook his head firmly. "No, I swear I didn't." She studied his face. Believed him. "Then how?" "Hospital's full of people with access to records. Someone looked you up. Someone always does." She closed her eyes. "I wanted to be normal." "You're not normal," he said gently, "and that's not a bad thing. Everyone looks at me differently now, because they see who you really are. They see what I did, not who I am. Those are the same thing." She looked at him. "No, they're not." Harding shifted in his wheelchair, wincing slightly as his shoulder protested. "When I was in the Marines," he said slowly, "I thought my identity was wrapped up in what I did, in my rank, in my missions, in my decorations. And when I left, I felt like I'd lost myself." She listened. "But I was wrong," he continued. "Those things weren't who I was. They were just what I'd done. Who I am is underneath all of that. And that person still exists, even without the uniform." She felt tears welling up. "I don't know how to be both," she whispered. "Both what?" "The person I was and the person I want to be. Why do you have to choose?" "Because every time someone looks at me now, they see the medals, the deployments, the hero. They don't see me." "Then show them." "How?" "By being exactly who you've always been. Kind, patient, brilliant. The person who saved my life by asking one simple question." She smiled through tears. "What question?" "Are you surviving or are you living?" She wiped her eyes. "I'm still trying to figure that out," she admitted. "Then let me help you the way you helped me." "How?" "By reminding you that heroes aren't defined by their medals. They're defined by what they do when no one's watching. And you've been a hero every single day. Not because of what you did in Afghanistan, but because of what you do here." Her breath hitched. "Thank you," she whispered. He reached over, squeezed her hand. "Thank you for everything." They sat together in the quiet chapel, two people trying to figure out who they were beyond the wars they'd survived. The next day, Calloway returned to work. She walked into the ICU at 0600 like always. But this time, when people looked at her, she didn't avoid their eyes. She met them, nodded, kept walking. The whispers continued, but they bothered her less. She was still E. Calloway. The medals didn't change that. When she reached room 14, Harding was awake, sitting up, actually doing the arm exercises Dr. Moss had assigned. "Morning," she said. "Morning, Lieutenant Commander." She gave him a look. "Don't start." "What?" "It's your rank. And E is my name." He grinned. "Fair enough." She checked his vitals, adjusted his 4. "You're healing well," she said. "Thanks to you. Thanks to you actually cooperating for once. I was never stubborn, just selectively cooperative." She laughed. "Genuine. Light." It felt good. 2 weeks later, Harding was discharged. He stood in the hospital lobby, walker in hand, physical therapist beside him. Eliza Calloway walked him to the exit. "This is it," he said. "This is it. I'm going to miss this place. Never thought I'd say that. You're going to do great. Just keep up with physical therapy." "I will." He looked at her. "What about you? You staying here?" "For now." "You ever think about going back?" "To active duty." She shook her head. "No, I'm done with that chapter." "Are you?" "Why does everyone keep asking me that?" "Because we see it in you. The restlessness. The feeling like maybe you're meant for something more than this." She considered that. "Maybe," she said quietly. "But right now this is enough." He nodded. "For what it's worth, wherever you end up, you'll do great things. Because that's who you are." She smiled. "You're getting sentimental." Harding. I'm a veteran with a traumatic brain injury. I'm allowed. She laughed. Promise me something, he said. What? Don't hide anymore. She nodded. I'll try. That's all I ask. He held out his hand. She shook it. Then, on impulse, he pulled her into a hug. She stiffened, then relaxed. Thank you, he whispered. You already said that. I know, but I'll keep saying it until you believe it. She pulled back, smiled. Go home. Harding. Yes, ma'am. He turned, started walking toward the automatic doors, then stopped, turned back, and saluted. Eliza Calloway froze. Other people in the lobby noticed, stopped, watched. Slowly, she lifted her hand and saluted back. The lobby went silent. Harding held the salute for 3 seconds, then dropped it, nodded, and walked out into the sunlight. Eliza stood there, hands still raised, tears streaming down her face. That night, Eliza sat alone in her apartment. Small, 1 bedroom, barely furnished. The kind of place that looked temporary even after living there for 8 months. She sat on her couch, looking at the medals she'd packed away years ago. 2 Navy crosses, Silver Star, Purple Heart, campaign ribbons, unit citations, pieces of metal and fabric. Symbols of who she'd been, but not who she was. She'd spent so long running from them, trying to be someone else. Someone normal, someone unburdened. But maybe that was a wrong approach. Maybe the goal wasn't to escape the past. Maybe it was to integrate it, to be both Eliza Calloway, RN, and Lieutenant Commander Eliza Calloway, USN, to understand that strength doesn't announce itself, that real power doesn't need recognition, that the loudest person in the room is rarely the strongest, and that the people who save you rarely introduce themselves first. She put the medals back in the box, not because she was ashamed, but because they didn't define her anymore. She was more than what she'd done. She was what she continued to do. Every day, every patient, every quiet moment of care that no one noticed. That was who she was. And that was enough. If you believe quiet competence will always outlast loud arrogance, if you know the strongest people are the ones who never need to prove it, if you've ever been underestimated and stayed silent because you knew your work would speak louder than your words, drop a comment below. Tell me about a time someone surprised you with their hidden strength, not the kind that shouts, the kind that just shows up every single day, without fanfare, without recognition, without needing anyone to know, because that's real strength, and the world needs more of it.